This user on Reddit compiled a list of sources showing why Doug Ford's privatization of the healthcare system will only make things worse for regular people. So let's take a look. One example of privatization not working is the for-profit long-term care homes during COVID, where the military had to be called in and multiple military personnel are now suffering from PTSD from what they saw. These for-profit long-term homes abandoned our elderly and vulnerable to the point where when the military saw their bodies, they had PTSD. Think about that. And Doug Ford's political choices are retroactively costing the province billions of dollars, with Bill 124 costing the province billions in back pay to public sector employees. And Australia's two-tiered system has resulted in worse outcomes for public patients who have to wait longer. This also leads to price gouging for the for-profit patients. Also, most two-tier models are incompatible with the Canada Health Act. And many two-tiered systems like Australia's actually lead to longer wait times in the Canadian system. And even within Canada, the provinces that have less privatization like Ontario actually feature lower wait times. Ford has also shown how cronyism is going to work in his for-profit system, with him awarding private contracts to people whose families donate large amounts of money to Ford and his government. And if the Ontario government is underspending on healthcare now, just wait until it's privatized. They will continue to squeeze and squeeze until the public sector is dying and dead. And don't forget about the billions of dollars that just magically went missing during COVID. Money that Trudeau and the federal government gave to Doug Ford for our hospitals and just didn't get spent, and we don't know where they are. And Doug Ford's $21 billion underfunding of the healthcare system is going to lead to shrinking hospital capacity. The fact of the matter is Doug Ford's underfunding of healthcare has caused people to die. And this number is only going to increase as his funding of healthcare decreases. Ontario cannot financially or for the health of its citizens afford more Doug Ford.